Good afternoon, everyone. Hello and welcome. Welcome, welcome, welcome. I hope you all can hear us well. We have an exciting conversation today, afternoon. So, welcome to our extended conversation series called Black Maternal Health in Your Neighborhood. I am Angela Doinsala Aina, co founder and executive director of Black Mamas Matter Alliance, or simply BMMA. And I am so honored to be in conversation today with Kay Matthews, who is the founder and executive director of the Shades of Blue Project, and she is a current board member for BMMA. Black Maternal Health in Your Neighborhood is BMMA's digital conversation series, spotlighting local leaders, initiatives, and organizations that are driving change in Black maternal health across the diaspora. Whether it's mental health, midwifery, or mobilizing for equitable care, this series is about bringing the work happening on the ground to the digital global stage. We'll do our best to answer our audience questions if time permits, so feel free to drop any thoughts or questions in the comments as we go. Now, for those of you who are new to our platform or tuning in rather for the first time, welcome. We are the Black Mamas Matter Alliance, and again, just simply BMMA. And we are a network of Black women-led and Black-led birth and reproductive justice organizations and multidisciplinary professionals working across the full spectrum of maternal and reproductive health to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. And so to learn more about the work that we do and to get some resources on all things Black maternal health, visit blackmamasmatter.org and make sure to follow us on all platforms at Black Mamas Matter. Also, you can sign up for our newsletter at blackmamasmatter.org/connect. So let's get right into today's conversation. And I want to talk a little bit about Kay. So, as the founder of the Shades of Blue Project, Kay Matthews and her team are on a mission to uplift all birthing individuals with the care, respect, and dignity they deserve, no matter their social status or birth outcome. They focus on the birthing experience. And this is how they bridge the gap by acknowledging everyone's birth story and that it matters. Through education, advocacy, and support, they are dedicated to helping birthing individuals of color whose lives are impacted by racial disparities that amplify their birthing struggles. It is from Kay's own personal experience of infant loss and postpartum depression that she recognized a critical diversity gap in mental health resources and in emotional support for Black and minority birthing individuals, one that she and her team are working to dismantle through their work in advocacy. And this year's theme for Black Maternal Mental Health Week that I'm so excited about is building an accountable village. And we'll be diving into how we collectively build sustainable healing systems that center Black maternal mental health, not just for the moment, but for generations. So let's jump right in. So, Kay, what does accountable village look like to you when it comes to Black maternal mental health? And how can organizations, providers, and even loved ones help build that kind of sustainable support? Well, I don't know about you all, but it seems like I can't hear Kay.
Hear me now.
Oh, I can hear you now.
There it is. He was
Wonderful.
trying to
Yes.
stop me already. All right. So let's
See?
hop into this thing. No, I
Mm,
first and foremost want to say thank y'all for having me on to have this conversation with you. And this right here is one of those things where I talk about an accountable village,
mhm,
doing the collective work together. Um, it is always my hope that when I'm out here and we're talking about this work and doing this work, that we are all looking for that outcome to be better than what it is, right? And so, an accountable village is if you're working on breastfeeding, we're working on breastfeeding. If you're working on abortion, we're working on abortion. Like literally, it is that collective collaboration of efforts that we are talking about when it comes down to an accountable village. We're all out here working to make this thing different. How we
mhm,
do it and who we impact, that's accountability. And then what we need for ourselves while we do it. the mental health part of it is not optional. It has to be mandatory because this is how we're coming up short as leaders. We're serving with great intentions and we're doing great things, but how are we focusing on ourselves in the midst of this? Because we're not exempt from the village. We are the village too. I always tell
Exactly.
folks, I am the community. I
Hmm.
sit in an executive director position, but at the end of the day, I've also sat across from someone's desk who told me that I made 73 cents too much to qualify for temporary services.
Mm.
And so I am
Hmm.
not exempt. That's accountability on so many different levels. It's collectively working together for greater outcomes across the board.
Absolutely. And what you just said, Kay, also reminds me of like why we have such an expansive definition around Black mamas. You know, too often people sometimes think that when they hear some of these statistics or some of these issues that impact Black mamas and birthing people, you know, they kind of think about other people and not necessarily us,
Mhm.
those of us that are actually doing the work. And that the fact that, you know, in doing this work around birth justice, birth equity, Black maternal mental health, we too are the clients, we too are the patients, we too are the ones that are impacted by these issues. And oddly enough, we're also the solutions and the
Right.
healers and the
Yeah.
people we've been waiting for, right? And
Yeah.
so being able to understand that foundationally to better support collaboration and partnership and that accountability, like you said, is so important. Thank you for that.
Yeah.
And so you know, thinking of the fact that we know the statistics, but we also know the living reality behind them, you know, like we're saying right now. So can you share what continues to be most misunderstood or under acknowledged about the maternal mental health experiences, especially for Black birthing people?
That one thing still lingers. Um, I know that oftentimes we talk about what doesn't happen, but we also need to start talking about what does happen. You know how somebody says, "Oh, we don't talk about that." Well, if I'm talking about it, we can no longer say we don't talk about it, right? We have to start asking, "Are you listening when someone is talking about it?" That's what's
Yeah.
misunderstood. The information, the resources, they're curated. Sometimes it's often who they're coming from, where one would say they're not talking about it. We've been talking about this thing for years. If you ever just watch an old episode, I promise you there was an old episode of the Jeffersons when they were talking about maternal mental health
Hmm.
when her daughter got pregnant. You know, I was just like, this thing is not new. How we talk about it, how we see it, who it's impacting becomes the thing where it's separated out. And so we have a lot of things to navigate. I call it a lot of trash to push through to get to the root causes of a lot of this. But at the end of the day, it's simply not listening. Or it is also thinking that we are exempt as a people from experiencing certain things as if we don't have enough to bear. It is that it's partly that strong syndrome that they place on top of us. I call it a
Yeah.
syndrome, just strong across the board. A
The
strong
strong Black woman
syndrome,
syndrome. Hmm.
yeah, but it exempts us from a lot of things, and first and foremost, our feelings, like they don't matter and they don't count, and that we got it. The strongest person is actually the weakest on the inside. They just are presented in that way. And if everybody keeps pushing that narrative, then they don't have an out or an opportunity. So the most misunderstood about what happens in our communities is that we don't need the support, and we do. Just like
Hmm.
anybody or any cultural component, you got to talk to us in a certain way for us to be like, oh, that's us they talking about, not them, like
Hmm.
us, like all of us. So this approach to tailoring it to be for us at the same time, creating blanket messages that don't necessarily exclude but include at the same time. Like that's possible because I do it all the time. So I have a hard time understanding why it can't be done because it can be. It's just a matter of doing. So it's looking at maternal mental health through a different lens
Hmm.
is
Hmm.
first and foremost. And there's going to always be stigmas. I think stigmas are just a thing that are always going to exist. What we're working towards, one of the key words you said earlier was foundation.
Mhm.
As a foundation builder and foundational work, you got to make sure this thing is around 30 years from now, right? And if you're trying to change the narrative, you're going to always be addressing the past harms, but how do you also amplify that with the solutions that we have? So we know the issue, but we have more solutions for this issue than we've been even given an opportunity to put out there. So that's it. The misconception is there are no solutions out here for us. Yes, there are. We just need to amplify them more in a way. It makes me think about even myself, how I come into this work. I came into this work, y'all, because I had to save myself.
Right.
And that is often sad for me to think about. Like, I'm not exempt from saying that I'm sad to know that I had to save myself and at the same time think about saving myself and then figuring out to save somebody else. That's crazy, but that's reality, right? But how do we stop the next woman from not feeling like she has to save herself and that she has access to resources right at her fingertips, right there where she can click and find what it is that she needs, and she doesn't have to navigate and feel like something is not for her, all these different things. Like, that's the reality that we sit in. Resources that, no matter what they are, I can relate to anything, to be honest with you. When it's all said and done, it's about access to the things. If I don't ever have access to them, how do I know I can relate to them? How do I know if there's support out there? So we're talking about a bunch of other things, but it's really saying that we are affected by these things first and foremost. It's like the big picture. That's why I want us to expand to understand none of us are exempt, no matter. This is why we focus on experiences of birth. Because if you only focus on outcomes, you miss a lot of people. And in mental health, people go into the darkness. They don't stay at the forefront of things, simply because they have a hard time feeling, one, like you understand all those different things, emotions that come into play. But that's the bigger picture, though, right? And so if we focus on people's experiences, you'll never not be addressing the maternal mental health crises that we're in now, because you care about somebody's feelings and not telling them like, oh, it's gonna be fine, or kind of get past that thing. Like, you got to be strong, you got to be all these things, but that's not real true reality. So that's where I feel like this thing with maternal mental health sits. As we see this day to day, that's the bigger part. We're not exempt from any of this, y'all. We experience it just like the next person. We just need to see ourselves in it so that we can start to understand that we're not exempt. They're talking about us too.
Exactly, exactly. So the the Shades of Blue project is rooted in community care and personal experience, like you said. What inspired this year's campaign direction, and how does it reflect what you're seeing on the ground?
So I always remember so vividly where we come up with these campaigns with. Like, let's be clear, we work on this all year. We close out one campaign, we breathe for a week, and then we come back and we at our whiteboard coming up with the next theme, and how does it relate to our everyday being and doing this work is how we came up with this theme. An accountable village is really like another twist on our collective effort. We believe in the collective effort. We do not want to do all things. We want to do things that make shift happen, and we know that that takes a collective effort to do so. So when we thought about this theme, it was like we need the village. We need people to know that we don't want to do this by ourselves. But we also, it needed to also be more than just a sustainable village, right? What will we provide? And when I think about longevity from a generational standpoint, that's where that came into play. And then how do we feed people? And I'm not necessarily talking about a plate of food, but how do we feed folks to continue to do this work and be effective in this work? Is how this year's theme came about. I have always, honestly, even in doing social support services and supporting our clients, I've always had a space for our leaders. It's like, who's checking for us when it's all said and done? Like, we show up and we deliver, but who's checking for us when it's all said and done, what we need, and who's feeding us and who's holding us accountable? So it was twofold. It's for the community and for those of us that are serving the community, is how this year's theme came about. And so that is also reflective of what I'm seeing on the ground. Good people are tired, and that's just it, because nobody is seeing them, or they're not feeling seen. And then they walk away, or burnout leads them to not necessarily walk away on their own. That's that forced walk away where you're not coming back once you're burnt out. I've yet to see anything different than when you're burnt out, that's the end. There ain't nothing left. That's why it's called burnout, right? So I've seen both and so how do we get to a point we're not just saving people who need help because we are the people and that somebody got to save us too. So that this year's theme encompasses the community and us as leaders who are out here doing this work.
Awesome. Awesome. So this work is emotional and deeply personal to so many. How do you and your team stay grounded, nourished, and inspired while advocating for long term systemic change?
First and foremost, it's in the tagline of my emails. Rest is mandatory, not optional. It's just not something we play about. I cannot expect for people to show up for me, their best selves, tired, mentally exhausted, physically exhausted, whatever that looks like. It can't happen here. And in order for me to get others to follow along with what we are shifting in the culture of doing this work, we have to lead by example. And so we take breaks. That's it. Like we literally take breaks because we be tired. Like mental health work is exhausting. And it's not just about taking a vacation. No, I'm saying taking a break when you need one, taking a couple of days off throughout the week, whatever is necessary for you to stay in the game and not feel worn out, not feeling overwhelmed. The days are overwhelmed. I'm also doing this work, right? So there are days when I gotta get up and walk away, or there are days when my staff be like, Miss K, you gonna go take a nap? That's a signifier that it's been a long day. I may need to, I'm not seeing myself, but being intentional so that every team member also sees themselves. When we can be like, I think you need to take tomorrow off. Log the hours and keep it moving. Like literally being intentional about this is not just saying this is hard work, but making sure that yes, it's hard work, but you have what you need in the midst of it. And that just lends to putting yourself first. Showing folks how to put themselves first is an actionable thing. It's not something we just say, it's literally something that we do and something that we do this work by. We don't compromise on getting what we need for ourselves. We were selfish around here, but that's how we show up our best selves for our clients and for the folks who trust us.
Absolutely. And I do think that, along with everything that you just said, going back to what you said, even in the beginning, the importance of also accountability, right? Because when, as a team and as a staff, when we're also accountable to the roles and responsibilities that we're doing, that allows for everybody to have the opportunity to rest, to have the opportunity to take vacation and leave, and again, show up in our best selves. For someone tuning in who wants to help but doesn't know where to start, what's one thing they can do today to support Black maternal mental health in their own community?
I would say, honestly, we are surrounded by not just pregnant folks. Let me be clear. It's not just pregnant folks. You got to think beyond that. You don't have to be listening to a lot of information that you hear just if you know somebody that's pregnant. Just start listening to women, what's going on with women's health or what's going on with the birthing experience so that we can all be educated. Sometimes I feel like not in every room for myself. I'm in a room for somebody else to overhear something. So I'm knowledgeable to take it back. And so, what we can start doing is really listening to what's going on around birthing in our communities and with our women, and those not just those horrible outcomes, the joys and things like that. Like combining the two together, because there are some folks out here who have wonderful birthing experiences, and I never want to leave that out because that's what we want. We want joy. Like literally, our hashtag is we choose joy, and we choose it by our own means, right? And so if we can see examples of the two together, that's it. I think it's really lending to listening and being aware about what's going on and picking up on information that is out there. Of course, I'm going to say by connecting with us because we do our very best to have mental health resources available across the board for anybody that's needed. The thing about doing this work is until the most marginalized communities are not the most marginalized communities, they will be at the center, right? It doesn't stop us from helping anybody who walks through our doors. Let's just be clear, because there is support that is needed across the board in this space. But there's a way to do that and to understand that. And we have to start listening to what's going on out here in these communities and finding and helping somebody. We lend with that phrase of mental health around it's okay to not be okay. The ending part of that, because that's a two-part phrase to me, is but it's not okay to stay there. It's okay to not be okay, but it's not okay to stay there. So we have to sometimes get out of the saying the hot topics and the phrases as well, because those things can be harmful. Because the moment you say, well, are you okay? Because you've been doing this for 2 weeks, then it's like, well, you said it's okay to not be okay, right? So we got to think about what we're doing and how we're saying it. And it's so much more than what we think about, even if someone says that I'm okay. Okay, well, I'm gonna check back in and make sure you still okay a day or two later. Like I'm not gonna wait. I'm gonna keep asking if you're okay. And then sometimes people know that they're not okay, but they don't know how to ask for help. That's one of the hardest things to do is to ask for help. I mean, that starts out our Inspire method is the eyes involving others. That's the hardest thing to do is to ask somebody for help. But here's the thing, when you ask somebody if they need help and they say, I don't know, ask them how can you help them arrive at what it is they know. They know. They just don't often know how to articulate it. So what I'm asking folks to do is to start listening and paying attention in a different way. And there are resources, y'all. In 2013, when it was me sitting and having to figure out things, there were no resources. I can 1,000% tell you if they were, I would not have had to save myself when it was all said and done. There are resources now. So we can't say that something doesn't exist. We have to start taking advantage of it, and we have to start sharing these things with other folks because you don't know what you don't know until you know it. Then it becomes your responsibility to share it.
Absolutely. Before we wrap up, Kay, please tell everyone listening today all about Black Maternal Mental Health Week, the dates, and what you all have in store for us.
Well, well, well. Yes. So Black Maternal Mental Health Week happens every year, July 19th through the 25th. Super excited, actually, Angela. We was working hard to get us to today so we could tell people that the new website with the new branding is up and available. So y'all can go to shadesofblueproject.org. The toolkit is live. The schedule is live. All the events and things that you can register for and participate in are live. We are kicking it off in Dallas with our Inspire Walk that is now open to folks statewide to participate. So this year we've rolled out that we have passed the reins of our Inspire Walk to the community to do that nationally. We have a day where we got our people with me. So there's going to be a line that you can actually call or a video that you could upload and say how important Black Maternal Mental Health Week is to you. And we are going to share that out. We have a policy conversation happening. We have our leadership retreat that will be happening right before the summit. And then the summit, y'all. If you haven't gotten your tickets to summit, you're gonna miss out this year. I'm just saying you're gonna miss out on all the greatness that is. It is a family reunion, is what we call it. We're gonna learn together, we're gonna cry together, we're gonna have joy together, we're gonna do some amazing things together. And that rounds out Black Maternal Mental Health Week. And of course, we'll be doing some social media things as well, but super excited for this year's campaign as we are every year, y'all. But every year it's a different level of excitement. But yes, what live on the website for you to be able to register for all the upcoming events and just see everything that we have planned for y'all.
Amazing, amazing. So again, for everyone, Black Maternal Mental Health Week is happening July 19th through the 25th of this year. Please visit shadesofblueproject.org to learn more. Kay, thank you so much for this powerful conversation and for the work that you continue to do to center Black mamas and birthing people. To everyone watching, whether you're a parent, a policymaker, a provider, a family member, or partner, this work requires all of us. Let's keep the conversation going beyond this week and continue building on Accountable Village together. You can learn more and support the Shades of Blue Project at shadesofblueproject.org and follow them on Instagram at Shades of Blue Project and connect with them further via LinkedIn, Facebook, all at Shades of Blue Project. And please don't forget to use the hashtag BMMHW 2025 Hashtag the conversation continues. Hashtag building the village. Okay.
Look,
Like like Kay said, everything is there for you in the toolkit to get involved. And please, you all, support the Shades of Blue project and all the wonderful things that they're doing. And we truly need your continued support, not only at Shades of Blue, but also here at BMMA to keep this movement strong and thriving. Like so many organizations doing health equity work, we're feeling the real impact of shrinking resources. And yet, the need for this work has never been greater. If you believe in what we're building, I invite you to become a recurring donor by visiting blackmamasmatter.org/donate. I need you all to know that your donation truly allows us to keep BMMA in operation. So to stay connected with BMMA, visit blackmamasmatter.org. Make sure you sign up for our newsletters and follow us across all social media platforms at Black Mamas Matter. Please be sure to sign up for that newsletter. That's how you get engaged and stay on top of all the great work that we're doing. And of course, where we always feature organizations like our partners at Shades of Blue Project. So until next time, thank y'all. Have a good one. Bye.